How the response has been so far is that while there could be some improvement so far, but initially when this was declared as an emergency, especially here in Kenya, and so for in other East African countries, there wasn't any outright plans to include the varied needs of persons with disability. That meant that amongst those that response was being framed around, persons with disability weren't included. And so it means that it was okay for persons with disability to contract the disease. It was okay for persons with disability to die from contracting the disease, because there wasn't any protocol that directly correlates with the issues of persons with disability or their needs. And it took, for example, in Kenya, it took nearly, I think, 2 months or thereabout for the government response committee to acknowledge that indeed persons with disability needed particular attention in terms of what responses they were giving out, even the protocol that they were giving out. Initially, even during the briefings, there wasn't any efforts to have sign language interpretation for our colleagues who are hearing impairment, so they were not getting any information for a whole month. So it meant that they are getting second or third level tier kind of information, which can be distorted. As you know, in communication, it depends on in the chain how you receive that communication. Perhaps there might be variation that then is not useful to you, and it might actually mislead you. So that's what happened. And then so some of our partners started lobbying to have just a simple sign language interpreter during the briefing, so that our deaf colleagues are able to receive information. But also, when protocols were being issued, and this speaks to the exclusion from the committee itself around the response, because when there was no representation of persons with disability, even just one person to guide about, given the varied needs of persons with disability, and different types of disability actually do have different needs, and how then you respond, it meant that we didn't have a specific protocol targeting persons with disability. There's a number of persons with disability who've lost jobs. There are people who, of course, succumb to the disease because of having pre-existing conditions, and they couldn't access medication or something like that, or it took long for them to be admitted in the hospitals. There are many persons with disability who have not been able to travel or go to the places of work because how stringent the protocols are, like getting into a public vehicle and using it and without feeling exposed because of the nature of disability. Persons with disability, majority of them do work within the informal sector. If you quantify the impact of COVID on businesses, because most of them have had to close shop and now stay at home because first, they cannot use the public transport. Majority of them decided to stay home. But here comes a government program that is supposed to help alleviate suffering, that the impact of COVID on young people and small business owners. And the first thing that a principal secretary, I think within the Interior Ministry, says is that for you to qualify to benefit from this particular arrangement from government, which is, by the way, paid by taxpayers' money or donations that are meant for Kenyans, by either from World Bank or all these institutions, then he says that you have to be able-bodied for you to, that's one of actually the primary qualification, not anything else, that able-bodied. So it means automatically persons with disability are not welcome. Yet we are saying we are helping the citizen to cope with the impact of COVID. That speaks to the fact that the work that we need to do as an institution and our support within the field is to leverage our strength in terms of communicating and helping people understand what do we mean by disability inclusion. In terms of emergencies, in terms of anything else within the country, how can we include that we are taking care of every person who is termed as vulnerable? And do we need to define what is vulnerability? And how are we planning beforehand so that this particular constituent is catered for, that we won't need to be reminding policymakers or people who are handling such programs? And one sure way is really just ensuring that there are policies that speak to, say, social protection. So there's different ways that we really need to work to ensure that issues of disability are spoken about, but also in terms of implementation, there's real action in terms of what do we mean by inclusion. And inclusion just means it starts from, do we have someone with speciality or someone with a disability or organization representing issues of persons with disability within the committees that make decisions around these issues.